Okay, so moving on into chapter 23, drug therapy for viral infections. We're going to learn about the characteristics of viruses and the common viral infections along with the clinical manifestations. We're going to identify the prototype and describe the action, use, adverse effects, contraindications, and nursing implications for antiviral agents to include those to treat herpes simplex and varicella zoster virus, cytomegalovirus, respiratory syncytial virus, influenza, the nucleoside analog antiviral agents administered for hepatitis. We're going to also learn about the nucleoside reverse transcriptase inhibitors administered for HIV, the non-nucleoside reverse transcriptase inhibitors for HIV as well, protease inhibitors for HIV, integrase strand transfer inhibitors for HIV, fusion protein inhibitors for HIV, and CCR5 antagonist for HIV as well. We're going to also identify the combination medications for HIV and describe their action, use, adverse effects, contraindications, and nursing implications, and implement the nursing process in the care of the patient undergoing drug therapy for viral infections. Okay, so we have our key terms, and we're going to talk about the antiviral medications that are used in the treatment of infections such as HIV, also what is genital herpes, hepatitis, herpes virus, highly active antiretroviral therapy, human immunodeficiency virus, immunocompetent retrovirus, and viral load. Viruses, etiology and transmission. So viruses are going to be, and we had already talked about these parasites, that are going to bind to receptors on the cell membranes. And the way that they're going to infect is through secretions, infected secretions, the ingestion of contaminated food or water, breaks in the skin, in the mucous membrane, sexual contact, pregnancy, breastfeeding, and organ transplantation. Now, the severity of the infection, guys, is going to vary. It could be mild, which is mainly a localized disease with few symptoms, or it could also be severe systemic illness that leads to death. So we have already established that viruses are intracellular parasites. They're going to come into the human host. They're going to bind to the receptors on the cell membranes, and they're going to come and replicate, come into the cell, and then they're going to use their DNA or their RNA in order to replicate. If it is DNA, then it's going to incorporate into the cell's DNA, the host cell's DNA, and replicate. If it is RNA, then it's called a retrovirus, and what it's going to do is that by using the reverse transcriptase enzyme, the RNA is going to be converted into DNA, and then the virus will replicate their generic material. Now, not all human cells have receptors for all viruses, and that's, thank God, right? Because that makes us resistant to certain viruses. But some do. For example, the mucous membranes in the tracheobronchial tree have receptors for influenza A. And then the helper T lymphocytes have the CD4 receptors for the HIV, and that's the same story for many of the areas of our body. However, we actually develop resistance. We develop immunity, and that happens by previous encounters with the virus, right? Our body and our body's immune system helps and fights and builds immunity so that when we encounter that virus again, we don't get infected again. Now, sometimes that immunity can just disappear over the years. It doesn't mean that it's forever and ever. Some do last, but some you you don't have forever. And also with the influenza, for example, the influenza um, the influenza virus, the influenza A virus, actually changes with every year. Viruses have a protein code, and that code will trigger our immune system to recognize that virus as an invader, and that's how our body will fight it, right? Our immunity, our immune system. So, what influenza A does is that it changes its code often, its protein code. So, that that way our body will not recognize it, and that's how we need a different vaccine every year, right? So that hopefully that vaccine will have this at least the majority of the strains that are going to be probably infecting during that season. Okay, so now let's talk about the clinical manifestations. If we have an acute infection, most of the symptoms are going to include fever, headache, cough, malaise, nausea and vomiting, muscle pain, diarrhea, insomnia, and photophobia. Now, the white blood cells are usually going to stay within normal, as opposed like when we have a bacterial infection where the white blood cells go up. And the signs and symptoms are going to be different according to the virus and also the tissues involved. And also, guys, sometimes viral infections may happen without signs and symptoms of the illness. Now we have the drug therapy, and we are going to talk about vaccines first. There is different vaccines that help us actually protect ourselves against viral infections. And we also have some medications for the treatment. And these medications are either going to inhibit the viral reproduction, but they're not going to eliminate the virus from the tissue. They're expensive, they can be toxic, and also their efficacy is limited. Now, some of the vaccines, guys, that that just come to mind that are kind of easy to recognize for me, it's hepatitis A and B. We have those vaccines to help. Of course, the flu vaccine. What else, guys? The HPV vaccine. Let me think about something else. Mumps, polio, and others. So prevention, and it goes from vaccination, hand hygiene, covering our nose and mouth, to all the way to HIV, for example, protection during intercourse, hepatitis, not sharing needles or infected needles, HPV, having their vaccine, right? So we also treat the symptoms, and we recognize and treat complications. Many times a cold could become a severe pneumonia, especially in immunocompromised patients. Not only those with HIV or cancer, but also many of our patients who are diabetic, they may develop a pneumonia just from a cold. Now, viral vaccines, these are going to produce active immunity before exposure. And they're a mean to control epidemics of viral diseases within that community. Examples of those are, of course, chickenpox, the HPV or cervical cancer, hepatitis A and B, influenza, smallpox, and others. The use of antiviral drugs and herpes viruses. The goal of therapy, of course, is to decrease the duration of the lesions, reduce the itching, and reduce the pain. We need to be cautious with renal patients when aciclovir is used. And we also need to teach our patients to stay hydrated. Now, the prototype is going to be aciclovir for the herpes simplex and also for the varicella zoster virus. For the cytomegalovirus, the prototype is ganciclovir. Now, the way that this medication, the aciclovir, is going to work is by inhibiting the viral DNA replication. This medication also helps to decrease viral shedding, and that's when a virus is actually exits the body, usually through exhalation or mucus, and that's at that time we're still contagious many times. So these medication decreases the viral shedding, and also it could be used for the treatment of encephalitis. And some of the adverse effects of this medication are going to include malaise, nausea, vomiting, diarrhea, and that's for the oral form of aciclovir. And for the parenteral, it's going to be phlebitis at the injection site, hives, itching, rash, elevated liver enzymes. That's important to know, the AST and the ALT. So it's not only the kidneys, but also liver enzymes, the liver. Encephalopathy, thrombocytopenia purpura, and hemolytic uremic syndrome. Contraindications for the drug are going to include hypersensitivity to the drug, heart failure, renal disease, and caution with nephrotoxic agents recipients. If the patient is taking other nephrotoxic agents, we need to be cautious. Okay, so I would like to now move on into ribavirin, which is the prototype for RSV or respiratory syncytial virus. Guys, the goal of these therapies to improve respiratory status. RSV is a very contagious virus among children. For the adult, could be manifested as a common cold, but for children, it is actually one of the main causes of pneumonia and bronchiolitis. So of course, we want to improve the respiratory status, right, of children. Now, it's talking about risk of exposure during pregnancy and being teratogenic. I tried to find a little bit more in the book, couldn't find much, but I found another source or a couple more sources which say that yes, the use during pregnancy is avoided, and also if patients, either male or female, use this medication, they need to wait at least 6 months before getting pregnant, okay? So I think that that's important to know. The way that this medication is going to work is by inhibition of replication mainly. And it will work on stopping the virus activity until, of course, the symptoms are resolved. Now, many times, kids may need these medication, right, to get better, and also medications to treat the symptoms. Of course, if they have fever, then we need to use Tylenol to help them with the fever. Remember, no aspirin, and since it's not always indicated depending on the age of the children, but we stick to acetaminophen for them. And of course, if there is respiratory complications, they may prescribe nebulizer treatments to help open up the lungs and until the symptoms or the virus is resolved. Now, we also have monoclonal antibody therapy for RSV, and the prototype for these will be palivizumab or palivizumab. And this medication, guys, it will work by inhibiting replication of the RSV. Now, it is only approved for infants and children younger than 24 months of age. Okay, so some of the adverse effects and contraindications are going to include skin rash, fever, antibody development, angioedema, dyspnea, hypotonia, respiratory failure, unresponsiveness, urticaria, hypersensitivity to the drug, right? An allergic reaction to the drug, thrombocytopenia. So it is contraindicated to people who has had a reaction or a hypersensitivity reaction to any humanized monoclonal antibodies. So we need to ask specifically if this medication is going to be administered to a baby or a child who's less than 24 months old. We need to ask the mom, has your children or your child, had any reactions to any other monoclonal antibodies, any other humanized monoclonal antibodies. These medication also should not be combined with vitamins, minerals, or over-the-counter medications, okay? So we need to assess. Many times, parents give infants some of those little drops that they put in the bottle, or some vitamins, some supplements. So we need to ask about that. Okay, so now talking about antiviral drugs for influenza, we have a couple of prototypes. We have amantadine, and we also have the oseltamivir. The oseltamivir is going to work by preventing the newly formed viruses to exit the host cell. So what happens is that the host cell gets penetrated by the virus, and then through a DNA replication, it replicates, and then it leaves the cell to go infect other cells. Well, this medication prevents that, and that's mainly known as Tamiflu in the market. So maybe the name will ring a bell. And then we also have the amantadine, and this medication works a little bit different. This med prevents the penetration of the host cell. So that way the virus cannot replicate itself anymore. Now, it is important that we pay special attention to the elderly population and patients with renal failure. That brings me right away to think that we're going to pay special attention to that. We're going to also educate our patients on how to take the medications, which it's going to include to finish finish the course of the medication, make sure that they know what to expect, what are some of the therapeutic effects that they should see, such as like they're going to feel better, right? Decreased fever, already mentioned malaise, pain, coughing, and rhinitis. They need to also know what not to expect, right? What are the adverse effects? For example, for amantadine, dizziness, lightheadedness, edema, pedal edema, and signs of orthostatic hypotension when they go from laying down to standing. For the oseltamivir, we can see as adverse effects CNS depression, lightheadedness, dizziness, nervousness with anxiety. Patients cannot concentrate, orthostatic hypotension, peripheral edema as well, the swelling of the legs. It could also suppress the appetite. Patients can become constipated, nausea, diarrhea, dry nose, and also some bluish discoloration or mottling of the skin and on the legs and the hands. Okay, so moving on into drugs to treat hepatitis, and the main goal of the therapy is to decrease the malaise, myalgia, the loss of appetite, and the abdominal pain and jaundice. Now, these drugs are used with caution in children and also patients with renal impairment. And it is important that we pay attention to the renal and the liver levels. Renal, it's going to be the creatinine clearance and the BUN, liver levels, AST and ALT enzymes. Now the hepatitis B virus prototype, or the prototype to treat hepatitis B virus, will be lamivudine. This med, guys, is, although it is used in children, it is used with caution because it could provoke pancreatitis. Okay, it could trigger pancreatitis. Now the drug to treat hepatitis C will be sofosbuvir. And this medication many times is combined with ribavirin and also with peg interferon alpha. Either, I think it's either or, and it will actually have serious adverse effects in the central nervous system. So we need to look out for fatigue, headache, insomnia, chills, irritability, rashes, nausea, loss of appetite, diarrhea. Okay. Some patients may develop anemia, angioedema, bradycardia, and lactic acidosis. So we need to just make sure that we pay attention to any of those symptoms. And as I mentioned before, for children, pay special attention if they complain of abdominal pain, because it could mean pancreatitis in children. Okay, so moving into the HIV infection drugs, and the main goal is to reduce the morbidity and the mortality that's related to HIV. The treatment is complex as there is changes and new medications become available. It is very important or essential that patients adhere to the viral suppression therapy, and the combination of antiretrovirals, it's the standard of care. And we need to pay attention to potentially serious drug interactions. So for example, the nucleoside reverse transcriptase inhibitor zidovudine is a prototype for this class, and that one shouldn't be given along with clozapine because it increases the risk of granulocytosis. Now, in regards to this medication, in order to prevent the maternal fetal HIV transmission, that's a transmission from mom to the baby, the fetus, zidovudine needs to be given right away within 6 to 12 hours after delivery, and it is necessary to continue administering the medication up to 6 weeks of age. In other circumstances, when the viral load of the medication is below the normal, then the medication needs to be combined with neviparin. So the main thing that I think we should pay more attention to is that in order to prevent the transmission from mom to newborn, this med needs to be given right away within 6 to 12 hours. And also on that contraindication, not to be given with cyclopin. Now the FDA, guys, has a black box warning on the different adverse effects that could be serious and this medication could provoke. Some of those include hemolytic anemia, bone marrow hypoplasia, leukopenia. So in that case, it is necessary to adjust the dose in patients who actually develop anemia or neutropenia. The risk for liver disease are going to be increased in females, and obesity, and also in pregnancy with the prolonged use of these medication. And it could also lead to hepatotoxicity, okay? So in that case, if there is signs of hepatotoxicity or liver toxicity, or also if there is lactic acidosis, the medication needs to be discontinued. So for this list of medications, guys, I want you to pay attention to the combination meds, bictegravir, emtricitabine, and tenofovir. And this combination is kind of new in the United States. It was just approved in 2018. The treatment is once a day, and this combination medication is going to increase the immune response, and that's going to assist in fighting infections. In about 8 to 24 weeks, the amount of HIV virus in the patient system will be lowered or undetectable. Now, this medication is contraindicated to be used with rifampin, okay? It cannot be used with rifampin, and also with dofetilide. That's another medication that cannot be combined with this one. Now, we need to pay special attention to the kidneys, guys, because this medication can actually increase the creatinine clearance. We also need to pay special attention to the liver because it will increase the ALT and SAT enzymes. Some of the more common gastrointestinal adverse effects are going to include diarrhea, nausea, abdominal pain, flatulence, vomiting, and also, guys, it is important that we assess and we educate our patients in the risk for bone loss and fracture, okay? So bone density needs to be monitored when this medication is administered. Now, for additional patient teaching guidelines, please go to box 23.5 in your book.